World Heart Day greetings to all True Diet viewers. Today we have a special guest, Dr. Anjali Agarwal, to talk about heart health. Dr. Anjali Agarwal is a physiotherapist, lifestyle consultant, a heart manual facilitator, and also a women health specialist.
How do we take care of heart in these pandemic times?
I think we are too much stressed out with all the worry and the fear of the virus, and the heart is undergoing a lot of stress already. So, the first key thing to remember is do not worry. Everything will be fine. So, don't worry, be happy. That is the mantra one everybody should follow because we are worried as to whether the virus would come to us or whether we'll give it to anybody and what it will do to us. So, that fear itself causes a lot of anxiety and raise in blood pressure.
Right,
Despite the virus, despite the pandemic, the biggest culprit is the blood pressure, which would go up when you're anxious, right?
right,
When our body is in a fight and flight syndrome, we are trying to fight our enemy and we want to run away from the enemy. The key thing which happens in the body, the chemical reaction, is called as a release of adrenaline hormone. It helps us to fight, right? The
right.
more release of this hormone will cause our heart to pump really fast. What are we doing over the years or over this whole months of pandemic? We are causing our heart rate to really go up and beat fast, which itself is not very good for the heart. So be happy, don't take stress. And if you do feel stress, sit down in a quiet place in your house. Try to close your eyes, and what I call is do the deep breathing. The breathing which I talk about is where we stimulate the vagus nerve. There is a nerve which passes right from the center and goes from your diaphragm down. That is the area which gets stimulated when you are in a fight, flight, stress environment. So, how do you take care of your heart is to do deep breathing as much as possible to control your BP and blood pressure. Second thing, don't be sedentary. Everybody is at home, working from home now, and that has caused a great amount of obesity being another pandemic which is coming up. People are putting on weight and people are cooking. They all become master chefs now. They're going to the
True.
kitchen and cooking food which is loaded with fat and sugar and ice creams. I see a lot of videos where everybody is putting all kind of ingredients which can make more obesity to go up. So mind what you are eating. That's one thing which Mayuri would always talk about. But
Yeah,
second most important thing is that we have to understand we need to add movement and we need to add momentum. So when you add movement, you try to burn some calories. And by doing that, you will help to burn out the calories which is getting stored in the body. By doing that, you control your blood sugars, you're controlling your heart rate, you're controlling the blood pressure. By doing just simple movement like getting up from the chair, like you get up at least about 100 times from your chair. You can work and talk on your laptop. You can do your assignments and meetings on your laptop, but you can sit to stand and work. That is again another thing which one can add. By adding standing is one more thing which will help your heart to be much, much better and healthier. Another thing is add entertainment in your life. I know the movie halls are closed, we are not able to go for shopping and all that restrictions in life because of the fear of exposure. But what I would say, paint, choose a hobby, read, run in the house, do some things which will help your heart to feel happy, right? Because when you are happy, you would have beautiful hormones flowing in your body, and that helps to beat the stress and that takes care of your heart. And most primary thing important is sleep. How much hours of sleep are you taking? Because sleep is causing your circadian rhythm to go off. What is the circadian rhythm? What time I will sleep, what time I get up, what time I eat my food. Our whole body functions around the circadian rhythm, right? So we say get up early in the morning when the sun is rising and have your dinner by the time your sun sets. That is the schedule which our ancestors used to follow. But now with growing time, what has happened is we got our laptops, we got our all social media apps open till 1 o'clock in the night, which keeps the pituitary glands very active. And then we know the hormone melatonin is also not helping us sleep in the night because it's all depreciated as we are not, sleeping at the proper circadian rhythm. We eat at 10 o'clock now because we are at home. We tend to work till late, till 1, and that all will affect our sleep pattern. So sleep at proper time and hydrate well. Why we say hydration is important? We know that COVID-19 and the pandemic has been leading cause for the blood clots also in our, blood vessels. So one has to be taking care to hydrate. The more hydration you have in your bodies, the chances of clotting decreases. You understand, there's a lot of people who traveled in the airplanes. We asked them to get up, walk, and drink water. Why? Because the blood gets coagulated in the legs. We called it as deep vein thrombosis, right? When the clots get into the vein, that clot can travel to the heart and can be a leading cause of heart attack or brain stroke. So the key thing is hydrate so that your blood vessels don't get thickened, don't get sticky, and at the same time, the movement of the blood is free, it doesn't get stagnated in place. So walk in the house, move in the house, eat healthy, sleep at proper time. That's the best way to take care of your heart. And smile as often as possible. Talk to your loved ones, talk to your friends. Don't feel isolated, don't feel lonely sitting in the house. And especially for elderly people, I feel they're missing to talk to their grandkids and grandchildren. They're not able to hug them and all. So I would say have a Zoom call. Now, social media calls you can do with your grandkids, and yeah, and feel loved with them. That is so important, that they need that outlet out with their beautiful grandkids or at least with their own friends. So if you are happy, your hormones will be working fine, will not stress you out. Your sugars would be all fine. Your insulin will not just spike up. And that's all, I think, for the heart to be so good.
That's great. So, in continuation to our
Yeah.
discussion, you were mentioning that the blood clots forming, and there are few articles mentioning that COVID is causing
Yeah.
blood clots,
Hello.
stroke, and heart attacks too. So, how it is
Hmm.
COVID is related with the heart
Yeah.
attacks?
So a lot of studies which was done in Italy, and then when they did the autopsy, they found that the blood vessels were getting very thickened after a COVID. So, and they saw a lot of blood clots in almost all the organs of the body, which was the brain, the kidneys, the liver, the heart, and the blood vessels also. So it's seen that the cytokine storm, or we are now terming it bradykinin storm, also everything is affecting the arterioles of the body, and because of which I think the leading cause could be the stagnation of blood getting what we call a disseminated coagulative disease. There's a coagulopathy which is happening with the blood, and the blood gets very thickened and sticky and can form a clot, which can be the reason of increased fibrinogen in the bloods, and that can stick to the walls of the veins, and that can lead to deep vein thrombosis. And when that thrombosis clot can get dislodged, it goes into the heart, blocks the pulmonary artery, so we might get pulmonary embolism. That's how people start to feeling like they're getting breathless, or they're getting
Oh,
panting, they're not able to breathe well.
okay,
And if it's going into our heart, it's also blocking the heart arteries, and heart is not able to function well, or it's leading into myocarditis.
okay.
So definitely there's a close link about the blood clotting and COVID, very much. So I think all of us as healthcare professionals should address it in a form of coagulative disease rather than an infective disease only. I think we'll get our answers addressed, and we can get a good recovery for our COVID patients if we work in those directions.
That's great. That's great.
Yeah.
Okay.
Thank you for watching. I'll see you tomorrow with another informative video. Like, share and subscribe.